StationMD is a telemedicine organization founded by emergency physicians. We have seen firsthand the kind of hardships that are imposed on patients when they're transferred to the ER unnecessarily. They experience the trauma of transfer. They're waiting in the hallway for hours on end to see an ER doc for maybe 5 minutes. They miss medication doses. Their entire routine can be disrupted. And a lot of times, this is for problems that can be managed where they are originally, in their facility or in their home. We founded StationMD to address this problem. Instead of transferring the patient to the emergency department, we use our technology to bring the emergency physician to where the patient is. StationMD's process is straightforward. Anytime a nurse sees something of concern that warrants a physician evaluation, he or she simply wheels in the station, enters some basic information, and the visit starts in minutes. Our technology allows for a physical exam similar to how one is performed in person, including a detailed head and neck, neurologic, cardiovascular, and pulmonary exam. A telestethoscope transmits sounds directly to the physician's computer and allows him to listen to the patient's heart, lung, and bowel sounds. In any setting, when necessary, a family member can be conferenced in. In home care and residential settings, a similar process allows us to evaluate patients and prevent unnecessary ER and hospital visits. The visiting nurse or caregiver carries a portable tablet that has the same capabilities as the station in the nursing facility. As in the facility, we perform a physical exam, we address questions and concerns, we make a plan, and we give prescriptions and orders when necessary.
When the doctor on call has limited information, that creates doubt. And when they have that doubt, what they do by default is they send that patient to the emergency department, because that's the only way they feel comfortable that that patient's going to get a thorough evaluation. With StationMD and our unique solution, we can communicate directly with that patient. I can visualize that patient. I can listen to that patient's heart and lung sounds, and I can get a thorough evaluation of that patient. With this information, we can make an informed decision, and oftentimes we can avoid that transfer to the emergency department, and we can manage that patient right where they are.
At StationMD, we treat our patients just like we would in the emergency department. We assess our patients, create a treatment plan, and then in a few hours check back in to make sure they're doing well.
StationMD doctors are credentialed at the facilities, giving them access to the patient's records. Typically, we can put in orders and document a full medical examination, just like any other physician there would.
So if after our evaluation we feel the patient still needs to go to the emergency department, we can help facilitate that transfer. What we'll do is we'll call the emergency department, doctor to doctor, and we'll speak with the physician. We'll address our specific concerns, and oftentimes this helps reduce unnecessary testing, and many times will prevent that patient from being admitted to the hospital.
Not only are the nurses and staff more engaged, but the patient satisfaction using StationMD goes way up. And as far as hospital transfers, we've reduced them by 50 to 60%. That keeps the patients in the facility bed and reduces healthcare costs overall.